We're taking all this important action this week because we know that Obamacare has failed the American people. We've been hearing this for years. We've heard the devastating stories. When we had the markup in the Energy and Commerce Committee, Chair McMorris Rodgers and I spent 27 and a half hours. They said it was a record for the longest committee markup in the history of Congress. And you saw a true battle between the left and the right. Those of us that want to rescue people from Obamacare and repeal Obamacare and replace it with reforms that actually lower costs, versus every Democrat on our committee who still wants to stand up and try to defend Obamacare. So clearly, there were very divided lines, but we were united as Republicans. Every Republican voted to advance our bill. And our committee, by the way, contains RSC members, contains Tuesday Group members, and contains Freedom Caucus members. Every single Republican voted to advance the bill because, as the CBO report showed yesterday, our bill actually delivers on the promises that we've been making for years. And that is, the first thing is we're going to give American families the freedom to choose their own health care back to them. That was taken away with Obamacare, where literally unelected bureaucrats tell you what you can or can't buy. Even if you like the plan, you can no longer have it. That's gone in our bill. American families have real freedom to choose their own health care plans. We also said we would lower the cost of health care. And of course, that was confirmed too, because of the market innovations and the freedoms that were given to families. We transformed the Medicaid system, something that's revolutionary, giving governors real flexibility to bring innovative ideas forward and make a very broken part of health care work better for families across this country. We reduced taxes by over $800 billion, putting real money in the pockets of working families. So this bill is an important first step. And as President Trump has said, and as we've all said, it's the first of 3 important steps. Secretary Price has over roughly 1,400 powers in current law to go and help stabilize the healthcare marketplace. And he's hard at work already doing that. So we are really happy with where we are because we've put a bill together, working with the president, to actually fulfill the promises of putting patients back in charge of their health care decisions, lowering the cost of health care, and finally stabilizing a marketplace that is collapsing under the failed weight of Obamacare.